Hello everyone, today here's RN Osama and this video will demonstrate how to give the medication into a locked IV or PVAD short.
Hi, Wendy.
Hi, how are you?
Very well. Let's show students how to give IV direct medication through a PVAD short.
Okay.
Okay. This patient, let's say he's asked for some analgesic.
Okay.
So I have gone to my MARs, I found the drug, went to my medication dispensing system, took it all out as per the agency protocol. Now, because this is an IV direct or IV push drug, I need to know how do I give this medication safely. So you go to the drug monograph. So most acute care institutions will have parenteral practices manuals, which will tell you how to administer all kinds of different IV medications safely, whether you can push them or give them direct, whether or not you have to put them in mini bags, what are the compatibilities, incompatibilities, how fast do you give it. There's a whole lots of considerations to think about. So I've done all of that.
Okay.
I have my medication ready, and I also, because this is a locked IV, I need to check placement, so I brought some saline.
Okay.
Okay, so I've done some hand hygiene, of course. I'm going to clean my needleless port. Usually it's 15 to 30 seconds, and then you have to let it dry. I've checked my patient's ID, 2 identifiers, and the patient has confirmed that. Okay, you have to let your alcohol dry. Okay, this is just some normal saline. I don't want to put air into the patient. So what's really interesting is the literature talks about aspirating. And as we know from learning about CVADs go into a large vessel like the vena cava. And because it's large, it's really easy to get aspirate back if the line is patent. With peripheral lines for PVAD shorts, they're into little small veins, so you can aspirate back, and often you'll get no blood return, which doesn't necessarily mean it's not in situ. So if students or nurses want to get in the habit of aspirating every time, go for it. I don't, because the chances of getting blood flashback are negligible, and it doesn't mean anything anyways. So I'm just going to inject some saline, and I'm going to look at the insertion site to see, is there any pain, is there any resistance, is there any swelling. Okay, so I'm going to go ahead and do that. And I'm just going to put in 3 or 4 mils, because you'll be able to see. Yeah. And then I don't know if you noticed, but I kept my cap sterile, because I'm going to just recap this, because I'm going to use this as my end flush as well. Okay, so I'm just going to do one last check of the patient, the drug, the dose, make sure it's me that actually prepared this med. And I'm just going to lure lock that one on. Now this medication says I have to give it over 2 minutes. So I'm just going to slowly sit here and inject. Thinking about at the 1 minute mark, I should be halfway.
Okay.
So we're gonna,
how you feeling there, Charlie?
Yeah, so it's a good time to talk to your patient, do some more assessment. So we're just going to time lapse it here. So we're going to say that 2 minutes is up.
2 minutes gone.
Yep. Okay. And of course, I'm always watching. I'm thinking about the drug and what is this drug and how will it work and what are the side effects. And I'm watching Charlie to see. That was morphine I gave him. So I'm looking to see, is it going to change his level of consciousness? Is his breathing going to stay the same? Not that it's going to happen. Changes will happen right away, but it's good habit to always be in. So now I'm going to do my final flush. But what I have to think about is that I have morphine in this line still.
Oh yes, so, outside here.
Yeah. So I'm just going to, for another minute or so, just continue to push slowly before I do my turbulent flush.
Okay. So that makes, what are you worried about? Like if you would push this in too fast?
Yeah, if patients receive medication too fast, sometimes they can get something called speed shock. Especially with your opioids, they feel like, whoa.
Get really flushed.
Yeah, their hearts start to race, and for some of them it's a pretty scary experience.
Yes.
Yeah. Okay, so let's say that minute has transpired, and now I flush my PVAD short according to my flushing protocol, which is 2 to 5 mils, and that's just going to be turbulent flush. And we can see that my IV has started to leak, so let's just troubleshoot this. So let's just make sure our connections are good. Yeah, so
this was just too loose at the hub here.
Yep. All right. Now I'll just take my MAR, I'll sign for it, and put it back where it belongs.
Put your side rails up.
Off we go.
I hope that you get benefits from this video, and thanks for watching.